The COVID-19 Delta variant is wreaking havoc in Gauteng. It's said to be the biggest contributor to the skyrocketing numbers of new cases in the province. So how should the President respond when he speaks to all of us later tonight? I'm joined by Dr. Aslam Dasoo from the Progressive Health Forum. Thank you for your time, Dr. Dasoo. What do you think the best course of action is for the President now?
Good afternoon, and good to be with you. Look, I think the President is in a bit of a tight spot, but as the whole government is. And the real tightness of this situation relates to the economy, not to what has to be done, regardless of what's going on elsewhere. So it's a case of how he's going to tighten restrictions that prevents spread of the illness, but more importantly, one hopes, create interventions that will expand the capacity of health services. Because at this point, that is the most important thing. In Gauteng, for example, health services are overwhelmed. And we need to have open new beds and have new staff by now. So I'm hopeful that he'll make some announcements on that. I think in addition, he should put a prohibition on all non-essential gatherings, including religious gatherings, close the places of worship, close restaurants, bars, etc. We understand, of course, that this will have economic impact on those institutions, but the government has a financial support package that hasn't been working well. They must make it work well so that these restaurateurs and pub owners and tavern owners can be financially supported and keep their staff employed. I think they should bring the school holidays forward and shut schools, not because schools are sites of infection, but it's the mobility of people going to and from school, both parents and teachers and the learners, that actually creates the risk of spread. So I think measures of that nature can be expected.
But is it not already behind the curve? Because as we understand, these infections take at least 7 to 10 days to show, and we're that much behind the curve. So putting all these specific actions in place right now, we're still going to see a continuing surge, are we not?
Sure. So how it works, so you're quite right, that people who are actively infected now, a proportion of them will become seriously ill and need hospitalization in 10 days to 2 weeks after infection. But, we're seeing that already, people who have been infected in the past 2 weeks coming through. The point is to prevent more people getting infected so that the health services can prepare and increase capacity for those who will be coming through who are already infected. So it's not too late. Of course, it's late in terms of having started this process. The horse has bolted, you're quite right. But right now, this is what we face. So we have to arrest the rapid transmission of this virus, this Delta variant, and institute increased capacity in our hospitals. The whole imbroglio around Charlotte Maxeke, fortunately, is over. That hospital has to come on stream urgently. Additional field hospital beds need to be opened so that non-serious patients, non-COVID patients can be decanted there. And the hospitals then utilized to meet the expected surge of cases. And I think all of these things should have been done a long time ago. They were warned in March already of this surge, almost to the week. And unfortunately, no one took it seriously.
I mean, I know perhaps it's not really helpful now, but is there a reason why the MAC and generally Department of Health seems to be behind the curve? Just last week, on Sunday, I was speaking to Professor Barry Shub, who chairs the MAC. I specifically asked him about the Delta variant in South Africa, and he said, nothing to worry about, or he said, it's relatively under control. 3-4 days later, those numbers are rocketing. Is it that we don't have the data quickly enough in order to prepare adequately? What is the reason we're always behind the curve?
Well, I think you alluded to it. I think Professor Shub was staggeringly wrong, and some senior officials in the Department of Health who said similar things. I heard an interview with him where he's more concerned with shielding himself from criticism of his peers rather than giving sound advice to the government. Look, but he's not the only person in the MAC. The MAC is made up of many clinicians, top scientists, and there is a problem. And the problem is that their recommendations, which are grounded in science by and large, from what we have seen in the past, but these recommendations go through this political grinder and come out as something else. Now, we first of all have no transparency about what happens in the MAC and what they're actually saying, and we have no transparency as to why what their recommendations have been changed by the government. And all of that creates uncertainty. So I think there's a case to be made for the MAC to become an independent public body that only looks at the scientific propositions and concerns around where we are and publicly makes its recommendations to the government. The government is entitled then to accept or not the recommendations, but it must then give reasons why it does that. That will create greater confidence in society. That will create greater trust. We are a low-trust society. So I think there is a serious problem in the MAC, and this is not to cast aspersions really on anyone serving there. They're all top clinicians, top scientists. I think it's the structure and the processes that are used that are hampering us. It's not serving us well at the moment.
And accountability is mangled as a result. But let's go back to what you were saying earlier around resourcing. Where do we get those resources from? Do they exist? And do they have to be brought in from other provinces?
Look, they're being sourced right now. Of course they're there. We have resources. They just haven't been acquired or procured or organized. And that's now, there's people who must be accountable for that. But right now, there is staff that can be hired. There are there are beds that can be opened, as I explained earlier. With the field hospitals, they have facilities, for example, next to Barra. They've got the Anglo-Gold Ashanti Hospital on the West Rand. That's just Gauteng. The other provinces are beginning to show increases as well, and the Western Cape is a particular worry. But the Western Cape, to its credit, has all of these processes in place. The private sector and public sector are fully coordinated, and they have a very clear idea of what they have at any given time. Of course, there are gaps, and they can do better, but it's a whole world apart from what we are facing. Here, the policies are being made on the hoof, and whatever you can do at a particular time gets done. And this is completely unacceptable, especially in this province, which has got so many people, but has equally got much resources that can be utilized.
Dr. Dasoo, final question, just to focus again in on the Delta variant. We've all heard about its far greater transmissibility. What we haven't heard much about is whether it leads to greater mortality. Is it more dangerous?
Well, that research is still underway. We don't know yet for sure. It may well be that it is more lethal and virulent, but what we do know is that it's 64% more transmissible than the beta variant. Now, but that's its real danger at this point for us, because it means more people will become active cases. And while the proportion of those who wouldn't normally get serious illness will remain the same, the actual numbers of those who get seriously ill are going to be huge, and the system doesn't have the capacity to help them. As we speak now, patients are being turned away from hospitals, having to go home gasping, no oxygen, and dying. And this is tragic. And there are hundreds of patients right now being treated at home, helped by NGOs, giving them oxygen, but it's a completely unsatisfactory way to treat people. With severe disease especially. So there is capacity. This variant, make no mistake, has cut a swathe through India that horrified the whole world. There is no reason why it won't do the same here. We, to make matters worse, have one of the lowest vaccination rates in the world. So we are completely unprotected. So if there's one message to go out to everyone, is that avoid getting ill. Don't get ill. And the only way to do that is to stay away from other people. The best way to do that is stay at home. And God, only if it's absolutely essential. Maintain your distance. Avoid all gatherings. Avoid certainly any gathering with more than 20 people that's not well ventilated. Just stay home. Protect your loved ones in the same way. This is a whirlwind right now swirling through the province, and you don't want to be in its path at all. There's no hospital services, satisfactory hospital services to assist you, so don't get sick.